Hello guys, we are the juveniles of tomorrow and we are going to explain you about a disease which is currently spreading fast, and it's not COVID-19, it is the black fungus. COVID-19 crisis have still not come under control, and now we have a new challenge upon us by another dangerous disease, like black fungus and white fungus, and it's truly very dangerous. Even COVID-19 may spare your life by 10% mortality rate, but these fungus are far more ahead of COVID-19. According to BBC News reports, mucormycosis, which we commonly term as black fungus, has an overall mortality rate of 50%. Which mean you would just have 50% chance of survival, and if it gets severe it can go up to 94%. But don't worry, we juveniles of tomorrow have enough information to educate you what black fungus is and how can it be prevented. Mucormycosis, called as black fungus, is an infection of Mucorales fungal family. Fungi in the Mucorales are considered opportunistic, meaning they usually infect people with an impaired immune system or the damaged tissue. These infections do not cause trouble in normal conditions and only attack and infect if they get opportunity. They get opportunity when a person's immunity is weak. It doesn't affect you if you have a healthy and fit body. Even if it enters your body, our immune system tackles it and you even won't know. But in the opposite case, it may infect you, and if it isn't prevented you can put yourself in a great trouble. According to NDTV, without even knowing, India has reported over 12,000 cases as of 26th of May. But the good side of the story is that even if your immune power is weak, it's a very rare disease and you are good to go until you are in a clean, good and tidy environment. For a fact, this isn't a new disease like COVID-19 at all. These fungal infections did happen before and they're now as well. It is called environment contaminant as it can be seen everywhere around us. In soil, in decaying fruits and vegetables. They are very common. But what changes occurred that in few weeks these have risen and are affecting people in large scale while they are not even contagious. For an answer for that, our doctors have seen a common pattern in these many cases of black and white fungus today. It seems like this fungus strike a patient in between 12 to 18 days after recovery from COVID-19. The case gets critical as the patient who has been just cured of COVID-19 may have not a strong immunity power, and therefore the person may get easily infected by these fungus and start suffering. The main key to prevent this attack by fungus is by maintaining a good immune system and prevent weakening of immunity power. There are many other factors apart from COVID that over immunity power can go down. Reasons for weak immunity power are: chemotherapy treatment for cancer, diabetes, overuse of steroids, immunosuppressive medication. The agents of these fungus are air. When you breathe, there are numerous spores of this fungus in the air which may enter our body, and this is the most common way. Through food, if the food is spoiled or has decaying fungus on it, it can reach your stomach and infect you. Through wounds, if the spores contaminate your wound, you are more likely to get affected by fungus. The area of the nose and sinus are the most common areas where the mucormycosis infections happen, and when the blood flow is restricted here, the skin gets discolored, often into a black color. This is why it is called black fungus, as it appears black. So how long does it take to spread? Well, when people are very immunocompromised, then the progression time is less than a week. The symptoms of this infection depends on the area of the body where the fungus is growing. The most common symptoms are symptoms of rhinocerebral, which is the sinus and brain mucormycosis that includes toothache, headache, nasal or sinus congestion, black lesions on nasal bridge, and fever. The second symptom is the symptoms of pulmonary mucormycosis, which includes fever, cough, chest pain, blood vomit, and shortness of breath. The third is the symptoms of cutaneous mucormycosis. It looks like blisters or ulcers, and infection area may turn black. And the fourth symptom is the symptoms of gastrointestinal mucormycosis, which includes abdominal pain, nausea, vomiting, and gastrointestinal bleeding. In these, rhinocerebral mucormycosis is the one to look out for mostly because most of the cases occur in there. And to diagnose it, you need to take biopsy test, and for lungs, X-rays and CT scans are the best. And diagnosing plays a crucial role, as this disease has a very high death rate. It is better to know it earlier to have a chance for survival. After diagnosing, if it turns out that the person is infected by it, then treatment goes on for 8 weeks from the day he had been diagnosed. States like Rajasthan and Telangana in India have already declared it epidemic, and there has been notification from the central government of India as well. They also have warned all the states in India about this disease spreading drastically. The available treatments or cures for this infection are antifungal medicines. Antifungal medicines called amphotericin B or Ampho-B are given to people for this disease, but according to news reports even the antifungal drug is in shortage. The second option is to go for a surgery. The surgery process is removing infected tissue from the body and sometimes leads to loss of the upper jaw and sometimes even the eye and other organs which are infected. Some news report says overuse of antibodies, excessive inhaling of steam and zinc supplement, as fungi thrive in zinc-rich environment, can also increase the chances of black fungus infections. If you inhale steam, moisture and humidity which is produced also gives a good environment for fungi to grow. And a question that arises is, are there different types of fungi? Like black fungus, white fungus and yellow fungus? For an answer, no. These fungi are not caused by different phenomena or reasons, they are all quite similar with a little bit of difference in the place they attack and mortality rates. Basically, black fungus is the fungus that attacks your sinuses area and turns black, and the mortality rate is 50%, but white fungus known as Aspergillus, these attack the tongue area and becomes white. Or white patches are seen in oral cavity or esophagus and the mortality rate is 20 to 40%. At a conclusion, stay aware of the situation around and make sure you recognize the symptoms and act as fast as possible to make your chances of survival more, and always be safe. Wear a mask and wash hands regularly and use hand sanitizer to make yourself and people surrounding you safe, and we, team of juveniles of tomorrow, pray that may everybody be safe and happy.